Good morning.
Good morning.
I know my voice travels, but evidently not enough without this thing. So, good morning, everybody. First of all, welcome. 2 days in a row in this forum, and I'm as much as I enjoyed yesterday, I'm really excited and honored to have been asked to kick off this particular session this morning. And I want to start by saying, number one, a really full crew here at 200 Whitehall. I see some cross-sector faces, not just the devices group, which is awesome. But then again, we're live streaming across Canada as well. So we have well over 100 people who have shown interest in this topic, which is fantastic. So we wave to the folks out in the field, and we'll be recording this session as well for those who were unable to connect right now. Okay. So as I was reflecting on how to frame this, I know that we often refer to the Credo, kind of our guiding document, and we do so appropriately. But there's really no better way to anchor this particular conversation than reflecting on the Credo in just a couple of ways. The first and most obvious way is the first sentence of the Credo, which talks about the people that we as an organization try to do our best day in and day out to serve. And those are the patients, the doctors and surgeons, the mothers and fathers, the consumers that use our products each and every day, whether they're pharmaceuticals, surgical devices, implants, or consumer supplies, et cetera. So, I mean, that's the face of today's discussion. We have a lot of ways of identifying ourselves beyond just mother, doctor, patient, et cetera, but that's one way that we orient ourselves from a business perspective for sure. I think we peel back the onion a little bit on the Credo and really proud about the way the Credo has evolved, which, you know, the Credo has not evolved a lot in its life history, but has evolved over the last few years to acknowledge this notion of diversity and inclusion, and specifically inclusion. And that's something that we can all be very proud of. And I think my 22-year journey with J&J, we've done a really good job, I believe, trying to embrace diversity. I think the bigger challenge, though, frankly, is bridging the gap from diversity to inclusivity. And you can see it as you let the screen wash over you and the words of the Credo that have been updated to involve that. But, you know, I look at inclusivity personally in two ways. One, a social lens, and the other, a more business lens. And so let me share both of those with you. I think the social lens is really, you know, what kind of company do I want to be a part of for my career? I said I've been here for 22 years. You don't stay with a company that long unless it means something to you, inspires you every day, et cetera. And if I think about a company that is at least striving, we're not perfect, but that is at least striving towards allowing each and every one of us to bring our best and authentic selves into work every day, I mean, that makes me proud to be part of that organization. Now, I know we have work to do for sure in that respect, but the fact that we're putting it out there in bold letters in our guiding document suggests we're definitely heading in the right direction, okay? I think on the more business side of things, and I feel compelled to talk a little bit about that, is there is a business imperative behind the notion of diversity for sure. And that is that our customers' faces are changing, our patients' faces are changing, our community face is changing, and we have an opportunity and obligation to match and mirror those faces in how we show up each and every day. And if we don't show up in that diverse way that our communities are represented, we're failing on the promise of creative thinking, innovation, and frankly, solving unmet needs for those folks out there in the community. So there is actually a business promise and obligation where if we unleash diversity, but bridge that diversity into inclusivity, that we can actually unleash the power of creative thinking and problem solving that diversity has been known to really support. Okay, so that's really all I'll say about that. I will say a big thank you to everybody for coming today, and I'm actually proud that the audience is even more expanded. We had to add more chairs in the back of the room as well. I know a lot of you are joining us online as well, either now or down the road as you watch this on video. But the group I want to thank most of all, because Laban and the team are going to talk about this, are those people who are coming here a little bit uncomfortable, frankly. You know, we're dealing with some challenging topics day in and day out, socially, politically, et cetera. And so if you're a little bit uncomfortable about sexual orientation or the fluid nature of the spectrum of gender versus what we typically think of the binary notion of sex, if you're thinking about race, all these tough topics, you know what, the only way we're all going to build a more inclusive culture culture is by making ourselves a bit more uncomfortable, learning more about it, learning amazing personal stories from people that we're going to hear about today, and building a better understanding. And I think that's a journey that we're on, and I'm really proud to take this step. So with that, I'll introduce Laban Cook, whose day job is overseeing our orthopedics business, sales side of things. But anybody who's come to know Laban as well as I've known, that his biggest passion, one of his biggest passions, is around this topic of diversity and inclusion, and as evidenced by taking a lot of his non-daytime efforts to support the Open and Out community as a lead sponsor and to be one of the lead proponents of our Enterprise Inclusion Council across J&J. So I'll turn it over. Thanks to our guests. You'll get a nice fond welcome from Laban, and I'll turn it over to Laban as well.
Thanks for that, James. I am trying to become the Jennifer Lopez of Johnson & Johnson, the singing, dancing, and acting. So just the double threat at this point, but we're trying. That was a great setup for this, and you know, this session is all about our guests. But what I just wanted to open with a few things. First of all, if we haven't met, for those of you who are in this room or those of you who are online, my name is Laban Cook. I prefer he. I am a cisgendered, middle-aged, non-visible minority male. And if you know what those words mean, then you're in the right place. If you don't know what those words mean, you're in the right place. I'm on a learning journey like many of you are. As you know, I'm very close with the Open and Out group, and one of the things that I've been so impressed by is this very ironically inclusive nature of the group, to say, come as you are. If you're an ally, nobody has a textbook for how this should be run, but if you're curious and you want to learn, then that's what we're all about, and that's what this is all about as well. I also, as you said, wanted to thank the Open and Out group. What a remarkable group here on campus. Their motto is be yourself and change the world. And I know that invokes images of Gandhi, but it also reinforces what James said about the business imperative. So the first objective we have today is that we affirm you as you are, whether that's identity, that's gender, that's ethnicity, if that's age, if that's baldness. Regardless of that, you are welcome to be yourself. And the second part of that is embracing this idea of the business impact, and it's completely real. Johnson & Johnson globally embraces the idea that if you have more diverse teams who are free to be their authentic selves, you will come up with more divergent thinking, which leads to more innovation, more agility, better execution, and better business performance. These things are inextricably linked. And so those are the two goals we have today. One, to understand as an employee and as a colleague group that we affirm how you are, as you are, and how you come to work every day. And also there's a connection to our business. So, you know, I'm very excited, as we said, about our panelists today. I think they're maybe even more excited than I am, and they're welcome to share their stories with you. We'll bring them up sort of one by one, but as you know, we're joined by Yuri, who is a patient, and he has a remarkable story to tell. I admittedly previewed on YouTube, and it was really impactful, and I learned a ton from that. We are joined by Melissa, who is a mother of a young man who's gone through this transition, and it's a really refreshing perspective as a parent. I know many of the parents in this audience think about, you know, what your obligations are to take care of and protect your children, and this is an incredible perspective as well. And then finally, and we're always honored to be joined by someone who's also a customer of ours, but Dr. McEvenue, who has done a lot of groundbreaking work in this space, and he's going to kick us off with his story and his journey. Dr. McEvenue?
I'll go to my slide. Okay, so hello everyone. Thank you so much for having me. Thank you, Johnson & Johnson. I know there's a lot of hard work behind the scenes, so I just want to thank everyone. And it's really an honor to be here, especially with a patient of mine and a family member of mine. I'm going to stop before I get too emotional, and my staff. So thank you very much. Anyway, I'm going to speak more as a surgeon, and I know it can be a sensitive topic, but I think it also can be a fun topic because I love my job and I love my patients. And to start off with things that get confused with naming is, what kind of surgery do I do? Is it gender reassignment? Is it transgender? Is it gender affirming chest surgery? Is it top surgery? There's so many terms, and all of them can be acceptable as long as we're coming from an inclusive and respectful place. And so gender affirming chest surgery is the term that I prefer because you're affirming someone's gender. You're not really reassigning someone because that's not my job. They are doing their own assigning. Biology is doing their assigning. I'm more affirming the gender that they come to me, that they're saying, hey, my chest appears more female and I want my chest to appear more male. And I can help them with that. I am a paid speaker for Johnson & Johnson. I have no other disclosures. Maybe one day I'll get some more disclosures. So again, I have a few aims. I want to help provide some definitions. Again, this is not the be-all and end-all of a gender talk. This is just my kind of experience. The McLean Clinic story, which I think is very special. Dr. McLean is a pioneer in this field, and I'd like to show respect for that. And really, the aim is about communication and connecting with patients. And I think from the credo, it's really nice. I think respect and inclusivity, just those two words alone would just summarize the whole talk. And so what is gender dysphoria? It's a knowledge that one does not belong to the gender that they were born with. We use the term cis. That's someone who's born a male, identifies as a male. And it's not a disorder. Believe it or not, until very recently, this was seen as a disorder. So that the medical community has come around and said, this is just gender variance is something that's normal. And a transgender is a term that's used for a person who does not identify with their assigned sex in their kind of thinking and thought patterns. And again, they're not necessarily in distress with this. It's not a disorder. It's not a distress. It's who they are. The population prevalence is very interesting. It tends to vary by country, sometimes up to 1.5% of the population, which means there could be like 2 million or more people who identify as transgender in Canada. And this is increasing societal awareness and acceptance. It's on the front page of Vogue. It's on our, the top of people's current events themes. And when I recently gave a talk in Brazil, there's a very famous Brazilian actor who had just kind of come out with having had top surgery. And that just speaks to it. There's a Toronto Star article from 2017 where it's almost 1 in every 137 US teenagers may be identifying as transgender. Now, we talk about gender spectrum, and I put 2 people up here who would be considered, male. That's a male, but he doesn't represent me as a male. And a female who probably doesn't represent every female. So a helpful way to think of gender is it's fluid, and there's a biological basis for having people that kind of fit everywhere in between these kind of extremes of what you may classify as gender. So what is top surgery, and what do I do, and what do I have a passion for? It's basically a mastectomy with or without nipple grafting that's tailored to the patient's specific anatomy. I'm trying to give a patient who desires it more male chest characteristics. And so part of that is removing the traditional female organ of the breast. And again, that's a gender reassignment or gender affirming surgery I perform. This can be performed on a wide variety of patients. Patients who are gender dysphoric, patients who are breast dysphoric, they don't like their breasts, and people who are non-binary, so they don't really conform to either gender, they just don't want the breasts on their chest. Testosterone has a big effect, so other gender doctors help out the surgeon by prescribing testosterone. You can see that's the result of top surgery, which is the removal of the breast, and then with testosterone you get the muscles and you get the hair, and you go from something that would be classified as very feminine chest to a very masculine looking chest. And now I'll speak about Dr. McLean. That's me on the right, that's Dr. McLean on the left, in case you didn't confuse who is who. And he's been doing top surgery since 1999. He was a real pioneer. This only became funded by OHIP in 2017. So before it was a purely private endeavor. There was no government support for this. And it was almost like an underground community where patients had to go online forums. There was a lot of, I'm sad to say, discrimination in the medical profession. A lot of surgeons didn't want to perform this surgery. So that's why Dr. McLean is a pioneer. He developed techniques which he's passed on to me, and really the McLean Clinic has become kind of a Canadian and worldwide center of excellence for top surgery. Why is that? Because he simplified the patient experience. He respected patients as individuals, created an inclusive environment, and eliminated barriers. Believe it or not, when a patient wanted top surgery 5 years ago, 10 years, they had to go to a psychiatrist and get diagnosed. If a woman came to me for breast augmentation, I don't make her go to a psychiatrist. I say, okay, are you an adult? Do you understand the surgery? Okay, I can perform the surgery. And so that's the informed consent model. A patient comes to me, they understand the risks, the benefits of surgery. We respect them as an individual, and we will perform their surgery. And with that success comes the problem of success. So again, OHIP funding began, and now our waiting list is more than 2 years. We have patients, sadly, that linger on waiting lists for a long time because the public system is kind of playing catch up. And remember, I said the prevalence in Canada, 1% of the population may be looking for this kind of surgery, a huge number. So my personal journey, I had no training in LGBTQ plus anything in surgery, which I think is a real loss. And I only became exposure to kind of trans health through the McLean Clinic. And as soon as I saw it, I was like, this is amazing. This is where I want to be. Can you teach me? And Dr. McLean brought me on board. We published his experience. It won a Research Day Best Paper at U of T. It won the Canadian Society Best Paper. We've had surgeons visiting the clinic because they've read our paper. We've shared our techniques. And I think it was important for other plastic surgeons not just to read our results, but so that they can deliver better care to trans patients around the world. And I think this paper has helped share the McLean Clinic experience. I performed over 330 of these surgeries in 2018 alone, and I've done around 600 surgeries of these to date. And those numbers are huge. No other surgeon does this other than the man himself, Dr. McLean. There's the article. And those are just some of the numbers. So Dr. McLean, did his first one in 1999, and look at 2017, 2018, and the numbers just keep going up and up. And it's kind of interesting. I just threw in Facebook, YouTube comes around, Instagram, and it's really the community, the kind of trans community, has really been a big advocate for us and has shared, who to go to for these kind of surgeries. And at the beginning, it was for discrimination. They had to, find their own way. And now, thankfully, we're more open, and patients don't have to be like that. Our patients, a huge range in age, education, ethnicity, what their partner status is, what their sexual preferences are, whether they're on testosterone. It's not a requirement for surgery. Whether or not how far they're going to go. That's Chaz Bono, had top surgery. So diversity. And just, some of our results. So a 20-year-old patient, again, with a very female chest characteristic, and they want a male chest characteristic. And all shapes, all sizes. It's quite remarkable. The first time I saw Dr. McLean doing this, I was like, this is amazing. And so inclusivity. So this sign is right at the doorway of our office. And I think it's important because patients know they're in a safe place. It says this is a place where human rights are respected. We respect you, whatever you are, whoever you are. We're supportive, we're respectful, we're personal. And I think as doctors and healthcare professionals, if you approach interactions professionally and respectfully as you would with any patient, then you're already doing what you need to do. I respect names, I respect pronouns. My job is easy because I meet people for the first time. I get to say, have you had a name change? Okay, what name do you prefer? What pronoun? So I write it down right there, and it's easy to get off on the right foot. And if ever I've made a mistake, or I just correct myself, apologize, and move on. And people really don't care if you make a mistake as long as you're respectful and they know you're respecting them as an individual. Again, the informed consent model is very powerful. We treat LGBTQ plus patients like we would treat any other patient. There's no difference. If you're an adult and you can consent for surgery, why would I send you for second, third, fourth opinions? No, we can come to a decision for surgery together. Publishing our experience, I think, is very important. We've been able to become a leader in this field. I think Dr. McLean was always a leader, but you need to publish these results so that other people can benefit from your experience. And again, we've trained other plastic surgeons, medical students, residents in these techniques, because that's the future. There's no way the McLean Clinic can do 2.5 million top surgeries. Other surgeons around the world need to pick up the challenge. And so I hope Yuri doesn't mind. I've got a really nice video. So after you go through surgery, there comes the reveal when the patient gets to see their chest for the first time. that's me. I'm talking about something very important. So the nipples are actually sewn on and they get a blood supply. It's called a nipple graft. And so we tape the dressings on. So this is a big moment for the patient because they've had surgery, they've waited a week, and they're seeing the chest for the first time.
Oh my God, you guys. Wow. This is crazy.
So it's a big moment. It really is. It's special. I've had hundreds of these moments, and I love filming them. A lot of patients don't want to be filmed for obvious reasons. They don't want. But Yuri, I knew was a special patient because. So thank you for letting us share that. So, connecting. So I think, I'm very lucky. I get to connect with patients all the time. And I think patients are your biggest ambassadors. They are really the key to success. I think staying in touch with patients, checking in, yearly follow-ups. My staff are here. They really connect with the patients. Patients know them. They're like on a first name basis with the family. It's really a special place. And I think that's part of the inclusivity of our clinic. Instagram has been huge for us. We've got over 14,000 followers on our top surgery account. And it's amazing the support of online community that has just grown organically. We don't moderate it. We don't do anything. Someone will write a negative comment and then there's like 10 other people that are like, fighting and defending. It's really amazing sometimes. And if I see a negative comment, I'll delete it. So I'll let that. And then YouTube, I posted a top surgery video as part of the publication to just demonstrate the technique. It's got over 130,000 views. So there's so many people out there that are interested in this, and that I think being a surgeon like this, it's my duty to share and publish and communicate what we do. And we do the Pride Parade. I think it's important to be an ally and to really stand up for the rights of people that have had a lot of historical oppression. And last but not least, I think, this is a topic where you can have fun. My staff are in this video, and I think, if you're going to be in this space, why not have fun and be proud of it?
Hey, what's up, everyone? Dr. John Carlo here at the Pride Parade. I'm happy to represent the McLean Clinic and Top Surgery. And what better place to celebrate inclusiveness than the Pride Parade? So let's go.
And no making fun of my dancing. But yeah, so thank you so much for having me. It's been a real honor. That's it. And I'm going to fast forward because I don't want you to see the rest of the dancing.
This is a safe space even for dance moves. So
Okay,
it's, that was amazing.
Good.
That was amazing. And I think, one of the things that I really took from that, when I said we're on a learning journey, is the biologic basis for this, and, how you highlighted the continuum of gender fluidity. And I think, even those of us who think that we've made a lot of progress, I think still are stuck in this unconscious bias of discrete buckets, right? And I want to label you, I want to label you, and that really reinforced that it's not that way at all. So thank you so much. All right, now we're going to ask Yuri and Melissa to come on up and join us, both up here in the chairs. We'll start with Yuri. I have to say, Yuri, Dr. McEvenue is the best hype man ever. Like, nobody ever gets that sort of opening, so I think that's very appropriate.
You know what? I'm really, really thankful for this guy. I can honestly say he and his team changed my life. I am on a first-name basis with them, and I'm not an exception in terms of, that relationship. Everybody has it. I heard about this clinic through word of mouth, through other patients, during the time that I was transitioning, which was 3 years ago. not that long ago, I had to diagnose myself as, someone with a mental health disorder, just in order to get access to testosterone and to get access to him, which was awful. And I had a wonderful doctor who was like, let's just sign this paper and have a cheers afterwards. But it's not okay. Like, it's not okay for people to be subjected to that. I've never struggled with any sort of mental health issues. I'm also on the spectrum of someone who never hated their body. It just wasn't proper. So when Dr. Giancarlo speaks about, someone having a breast augmentation versus someone having a top surgery, that was the exact position that I was in. I was someone who had lived in my body, was absolutely, it was my body, that's great, but that wasn't what I wanted. And it got to the point where I was almost 30 years old. I look young, but I'm not. I'm gonna be like elf forever. But yeah, I was quite old, and it was usually people get this started pretty early in life. I wasn't, because I kind of, I argued with myself a lot, because there was that, ideal of you must be in a really bad position in your life in order to go and deal with all of these changes. There is no other way. And then obviously I got to a point in my life where I was old enough to realize that no, I don't have to be declared anything. I don't have to feel a certain way or, per se fit in a certain box. And I can still choose to be the ideal person that I want to be. And I'm that person all around, whether it comes to work, the way that I look, what I'm wearing every day, it must be up to me. So this is kind of a really great environment. I'm really here to answer any of your questions and openly, so please feel free to ask me anything at all. And next.
Perfect. That's a good primer. And that's going to be the bulk of our conversation. So on Yuri's cue, do be thinking about all the questions that come to your mind. I think, Yuri and the panel have been very, very open. I think all the way from something that sounds like a very well-informed question to something that you're not sure it does. I think that's okay. So a great segue over. Melissa, you obviously have a very different perspective, but one that's very interesting as well. So maybe explain a little bit about who you are and how you arrived at this stage.
So my name's Melissa. I'm a mother of 3 boys, and I thought I'd be a lot less nervous. It's a very emotional journey for all of us, I think. As a mother, I work in the industry of plastic surgery as well. Actually, I'm a patient consultant. So I walk people through this journey all the time, but when I was walking my own son through it, that was a whole different perspective. I had to sit back and just be mom. And I said that on day of surgery, actually, because my son got the privilege of being one of his patients only very recently, actually in July. So again, we went through the whole sick kids. He had to be diagnosed, and we spent many hours in Emerge. He was young, and even my family and friends told me, he's too young. You shouldn't be doing this. He's going to regret it. But again, I'm open to answer any questions, but I'm going to pass the mic along now.
Okay, perfect. Thanks for that. So maybe Dr. McEvenue, we'll start with you, and now I'd like for the audience to start thinking about your questions while I tee this one up, because it struck me, we talk a lot about the resistance and discrimination that a patient feels on their journey. You alluded to in your talk about, as a medical professional, there is that resistance within the medical community. Could you explain a little bit more about, as you started this, the sort of barriers that you saw professionally and how that has evolved over time?
This is a very difficult question because, I think the discrimination was way before my time, and it started a long time ago, and the medical system is very slow to change, very resistant to new ideas, and that's just the way the medical system works. I think my personal journey is illustrative because, I went to the best plastic surgery training program in the country at the University of Toronto, and there was no transgender program or experience in the university. And I felt like when I met Dr. McLean that I had lost a huge opportunity to treat patients and learn techniques that are valuable. And so, thankfully there was Dr. McLean, and I latched on to that opportunity and, to learn from kind of a master. So I'd say that, I didn't really face outward discrimination. I just felt that the absence of a focus on care, or an absence of, why is there no trans-focused program or now a gender-affirming rotation in my education? I feel it's almost like there was a lack of attention. Thankfully, I think things are really changing. I think my paper with Dr. McLean came around at a really opportune time because there was no scientific literature on this stuff. Now there's tons, and people are playing catch up. And Women's College is now getting a trans health program, and OHIP began funding this Operation 2017. So I think things are changing, but it was I think a little bit late, and that's all I'll say about that.
Okay, fair enough. Fair enough. Do we have any brave souls in the audience? I'm sure we do. Jen?
So just in terms of...
We'll get the microphone over here for you. We're by the book.
We're going to have to double up on Thanks, Hillary. So does that barrier still exist? Do you still need to be, I don't even want to use the word, but I'll say diagnosed with a condition or be in distress to be covered by OHIP?
So there's a bit of a gray area here, and there's been a gray area for a few years because there's a huge proponent to they call it the kind of the informed consent model, which is the consent model we use, which is, if you're an adult, you can consent for surgery, you meet a certain age requirement. That's called the informed consent model. There's also the WPATH model, which is the older model. It used to be that you need to be on testosterone, you need to be living in your gender role for a year, and you need to be diagnosed by a psychiatrist before you could have any gender surgery. That is changing. The newer WPATH guidelines are becoming less stringent. The current law in Ontario is you need to be diagnosed with gender dysphoria, which is a better term than gender identity disorder, by someone who is an expert in gender health. That could be a nurse practitioner, that could be a family doctor. So the barriers are dropping, but there still are more barriers for gender surgery than there are for other surgeries.
Good question. Thanks for that. In the back there? Hillary's going to get her steps in. Don't worry about it.
First of all, thank you guys so much for coming. You're an inspiration, so we really appreciate you guys being here. I guess this can be directed to any of you. What resources, if any, did you guys use going through this process that you could recommend to maybe someone else going through the same thing?
Sounds like a Yuri question.
Yeah, I have lots to say about that. Honestly, it's pretty roughened out there with resources. The only way that I was able to find my doctor and that I was able to find, additional support was through the many people in my life that are transgender. Even when choosing a doctor for my top surgery, you're essentially supposed to pick the doctor yourself. You're given a list of doctors who do the surgery. That alone is stressful enough because I'm not a doctor yet. I'm supposed to pick this myself. Okay, sure, yeah. But because I knew a lot of people, everyone would let me know who I should go for. So luckily I had that. But I've had friends, younger friends. I even have a kid who I call my son, and he had nothing, nothing. He came here from Windsor. He was alone, super depressed, no resources, no doctors. And I was able to get him onto my doctor. It was a referral process. He had to wait 3 months. It's not easy to get to my doctor in specific. I called her every single day for 3 months. Every day, until she gave me an appointment. So, yeah.
Persistence.
Yeah.
Great.
That's a shout out for Liz. So literally, I told you about that 2-year wait list. So we're talking about hundreds of patients that are interested in this surgery, and my lovely staff with the biggest hearts, they have to tell these people, call back in 2 years. Call back and, we don't even have a time to see you for a consultation. That's how much of a backlog there is.
Excellent. In the back there?
So thank you for coming. I agree. I'm really inspired to hear about your story. The story itself is actually in my family. I have a young cousin, and she was born a female as Caitlin, and she is now Kenny. So this is something that's kind of, it's really kept to the inside of my family, and I've never really discussed it with anybody before because it's uncomfortable. You're right about that. So I appreciate what you've told me today. What I'd like to know is, do you have any advice about dealing with generational gaps? So the grandparents, very big hurdle because really young kids have a lot of education about social media and they hear about this, we're exposed to it. But grandparents, not so much, but it's heartbreaking. So I would appreciate if you have any advice about how you might have dealt with that.
Great question.
I think I can take that one. Yeah, it is absolutely when these things are said to the older generation, it's difficult because there is no understanding. If you're lucky enough to have the understanding, then that's fantastic, but unfortunately that's not common. In my son's story, it was something that he very much wanted to have that discussion in person by himself. It was something that he didn't want us to discuss because he wanted to have that just pure, raw conversation. If somebody understands at some point, or if someone's open to understanding, then great. Unfortunately, if they don't, then at that point, you decide where they fit in your life.
I can give some of that too. Honestly, I'm Cuban. I come from a very conservative Cuban family who don't even understand what a trans person is. Like they honestly have no clue. They all live in Florida, so I don't live anywhere near them for a reason. But you know what I can say to you, it's honestly pain. The one person I really connect with in my family is my grandmother. You know, not for any specific reason. My family did their best when they were raising me, and so did she. Like she didn't stand out from the pack, but that's just the person that I connect with, and she doesn't understand at all. Like she just hears the word sexual. Like that's all she hears. When you say you're homosexual, when you say you're transsexual, she just hears sexual. That's it. So with a person like that, it is so much pain. It is literally just sitting there and like just taking it and having these private and ridiculously painful and long conversations. There is absolutely no way around it. Like just none. Yeah, it sucks. Yeah.
It's heavy.
Yes, hi. Is there an age limit before, because you, sorry, Melissa, you mentioned that your son was quite young. You look like you're very young yourself, so I'm just assuming.
It wasn't just me. Fuck that.
So I'm assuming your son must have been very, very young. So what is I guess, the age limit where you think a child is, I guess, emotionally intelligent enough to understand that, yes, I want to do this, and think you're not going to regret this 5 years from now, 2 years from now? That's my question.
I can honestly tell you, I knew that my son was going in this direction when he was 4 years old. He was on an ATV, and I said, "Way to go, princess." He stopped that ATV so fast and looked at me and said, "I am not your princess." And then I truly started listening to him. So as things opened up and around 11, and you know, the attire changed and the demeanor and the friends and everything else changed, I really knew at that point that he was ready to pursue whatever he needed to, and he did a lot of research on his own. By 12, he developed breasts, and they were large, and they just kept getting bigger and bigger, and I saw the change in him, and I just thought, why would I hinder this journey for him and take away his teenage years? Why would I do that? So once he actually could make that decision and said to me, like, I've done my research, I want to have a consultation, and it was the journey that we started because it was not my body. I gave him life, but I certainly wasn't going to live it for him. So for me, I think that there's no appropriate age number. I think that, you know, once you hit that spot, like Yuri said, you know, he was significantly older. There are, you know, some patients that do this at 15 years old, as my son did. Other people who live in the body that they're uncomfortable with until they're 30, and whether that's from not having support or not having the means to, like Yuri said too, sometimes it seems impossible. You're given this list of things and you're expected to know how to pursue this journey. And that, I think for me, with my son being so young, I was just his support network to allow him to do that.
And I would like to touch on the age. I don't know if I talk with both. So the age one is a super controversial issue in the medical community right now. I think there was recently a big story in the Toronto Star because Sick Kids does have a gender program, and they are starting children on hormone blockers and hormones at an earlier age. And this is controversial because some proponents would say that they're not capable of those decisions. Medical people would say if you can stop puberty and help them go on the journey, you're going to have a better phenotypical outcome. So, you know, what I mean by that is if you never let a female go through female puberty or a male go through male puberty, and you get them on the right journey, the journey of their choice, then the final, you know, way they look as an adult will be closer to their mental identity. So there's arguments on both sides, and my personal opinion, and I'm not saying this is the right opinion, is it should be an individual case-by-case basis that the family and the doctor make on their own together. And so what age that's going to result in would be highly individualistic. That's my opinion.
It's very thoughtful. I think, Melissa, going back to, I think you had said previously to me that you had this powerful crystallizing moment when you were wrestling with this. And I know it's a bit heavy, but could you just share what that sort of introspective moment was?
So regardless of how someone identifies, teenage years are tough. And the suicide rate is unfortunately very high. In the trans community, it's even higher. And I woke up one day and I thought I'd rather stand beside my child than over top of his grave. And if I chose to not support, that was a really big possibility. So, I mean, it's something that I think a lot of parents, they want to support. And regardless of whether you understand or not, that's not your job. Your job is to support. And that's what I wanted to do.
Thanks for sharing that. But it does frame up the size of the support challenge there. Thanks for that. Okay, so I know we have another question in the back there. Laura? It's a strategic pause break for a glass of water.
Hi there. My question is a bit around just following along the resource question. Just wondering for patients who might not have a Melissa as a mother, what tools and resources are available for the family and friends, I guess, that surround the patient to help better support them, either leading up to the surgery or after the surgery?
Can I touch on that one for a little bit? So I like to keep my talk positive, and I just kind of allude to discrimination, but Melissa brings a really important point. The suicide rate in trans teens and preteens is like 50% higher than other non-trans teens, and that's a huge number. And so, a lot of what I think, positive, changing lives, giving the chest, sometimes it's saving lives, this surgery and these medical treatments, you're saving a life. And I just want to underscore the importance of that, and that's why there's a big public debate going on right now with the other question on how old, what age, should the government be in charge of saying a strict cutoff? Should doctors be in charge? Those facts should be remembered that, a lot of times this is a life-saving operation.
That's a good point.
Yuri might be good to touch on this as well for support. There are different groups such as PFLAG. There's a rainbow camp that is more geared towards the actual youth. But we used to go to a weekly, and we no longer do because we kind of feel like we still go every once in a while to support others. But in this group, what they would do is separate the teens to the young youth to the adults, the parents, the grandparents. And it was very diverse in the parent and grandparent group because some people were there very hostile. They didn't want to be there, whether it was a mother that was bringing a father or a father that was bringing, his mother as a grandparent. And we all would sit around a discussion table, and it was just honest discussion of, how do you accept this? How do you move on to support the best way possible? So this is a weekly group that, Dylan and I attended quite often. And I even said to him one day, I said, do you really want me to continue going? Because I don't need support. And he looked at me like I was the dumbest person in the world. He's like, well, Mommy, there's other people that need your support. So, that was one group that we really went to quite often. And, as in regards to other support networks, I think.
Honestly, I've never really had family in my life that closely, so I've never had to use any of these particular networks. But what I can say, just from my past experience, is just be there. When you're on testosterone and you're getting ready for surgery, and in my case, your uterine area will come out at some point. You do need someone to show up for you, to bathe you, to take you to appointments, to take you to I have a blood test every 3 months. Sometimes I don't feel good. Testosterone definitely has its ups and downs, even emotionally. So, just being a source of support and you yourself being that resource is really, really important. I wish I had a little bit more of that. So.
That's fantastic. One thing I will, just a plug for the Open and Out group, one thing that really struck me, it seemed obvious to me that the employee resource group served as a home base for people that identified as part of the LGBTQ plus community. But what's really struck me here at Johnson & Johnson is it has served as a resource group for parents who are going through that journey. And some of you that are part of the Open and Out group have been very generous with your time, either if you identify as part of the community or we have people part of the group that are parents who have gone on that journey. So one thing I will say is even if you don't feel like signing up for membership, but if you want somebody to talk to behind a closed door, you definitely have a host of colleagues here who have gone through that already that are very happy to help you out. I know there was another hand I thought I saw. Yeah, right there. Carrie.
Hi, thank you so much for coming today. It was a very inspirational and moving talk. I want to know, as an organization, what can we be doing more to support, because we're talking a lot about support, somebody who's transitioning. I mean, I think about sessions like this, for sure, and creating an inclusive environment to gender-neutral bathrooms, but just please help us think about what we could be doing more to help support someone who's going through this.
So at the beginning, I used to work at a wonderful, wonderful charity. It's called Furniture Bank. I don't know if you guys have ever heard of Furniture Bank, but they're amazing. Great place. And I worked there for 3.5 years, and I was very happy in my role there. So when I started to transition, my voice started to change. I started to get a lot of facial hair. And it got to the point where I physically passed. I no longer looked female, but a lot of our corporate staff and a lot of our volunteer staff who was not there all the time really struggled with my pronouns, really struggled with calling me, my name hasn't changed, so they didn't have to call me a different name, but they just really struggled with anything regarding my journey. They didn't want to talk about it. I remember once at work, someone actually asked me to start a meeting off saying that I was transgender, which I think is so inappropriate. But this is how lost they were. They wanted to make the environment better for me, and I was like, this is not it, guys. This is not gonna work. But they really went out of their way to just provide me days off. The assessment process is large and long for this. You need a lot of time off. It's a 3-month assessment process. There's 5 different assessments. You essentially have to pass all of those, do all the blood tests. I mean, it's a lot. So I got about 2 weeks from them just to kind of get up and go whenever I needed to without worry. But I will say the pronoun thing was a really big deal, and I quit. And I quit because I couldn't do it anymore. I couldn't. At this point, I didn't have breasts anymore. I just was not living my life any sort of remotely a feminine way. So the only time I had to deal with this is when I came to work. So I did not want to leave. To this day, I love that place. I wish I never left, but I could not deal with the just missing of the pronouns. And I'm a person who is not as conflictive, so I'm not gonna burn you for that or say oh, you suck, you should have called me this or blah blah blah. That's just not my style. So it's not I would go out of my way either to be hey Bob, stop it, right? So just really remembering if the pronouns are a difficult thing for you, just try and stick with names. Just practicing it. I'm not perfect. I have many friends who are non-binary, and I screw up their pronouns all the time because I am not non-binary. So for me, I still go he and she. So it's very difficult for me to get attached to that they. So, I'm going through this journey too. It's not just you guys, everybody is learning. So yeah, just really trying to stick those pronouns is so important. So just try very, very hard if that ever comes around.
Yeah, that's a good point.
Sure.
Yuri, this is maybe more specifically for you. How do you find the courage throughout these years to stay true to yourself? And this is not specific to people going through this journey like you have. I find that a lot of times we just find it's so hard to just be true to ourselves. We're constantly in denial of something or the other, and we constantly have people who are talking us out of things that we know deep down inside we want to do, whether it's not staying in a relationship that doesn't serve us anymore, or we know these things, but we find it hard to filter out the noise, and we get talked out of things, and we live a lie a lot of times, everyone. How did you find the courage to stay true to yourself and disregard things that weren't serving you, the people who weren't? How do you stay true? Because it's a really hard thing to do, I could imagine.
Thank you.
Good question.
Very nice of you. Thank you. honestly, like, the will to live is big. Like, I'm one of those people, I learned how to do pull-ups because I was scared if I'm ever hanging off a cliff, I can't pull myself back up. And now I can do 8 pull-ups, so I know for a fact I will not die. And I'm dead serious.
8 cliffs.
8, I can do like 8. I can like save myself and someone else at this point. So, you know, it's really, I have like a yearning will to live. I'm an immigrant, you know, I came to Canada from Cuba when I was 11. We've barely had family in my life. Life has not been easy, but I really want to be here. And I really want to be here doing me, 100%. And I don't really let anybody get in the way. And you know what? I've been really rewarded by life. You know, I've had a really shit life, and I've had a fantastic afterwards. So I'm very, very happy with all the goodness that I'm getting, and you know, I'll take all the crap that I need to continue receiving the goodness and being my authentic self. Like, you know, I've been told at work so many times how I'm not PC, and you know, I should be in a certain, you know, if I'm in a certain environment, I should be a certain way, and you know, I still have a job, and I still have a quite nice life. So I'm gonna continue doing me. But thank you. That is so sweet, and I really appreciate it. Thank you.
Wow. Yeah, I think that was an amazingly profound note to finish on. Unfortunately, I'm super distracted by the fact I'm now terrified that I can't do pull-ups. So I wrap myself in bubble wrap until I can get at least 2 going. Look, that has been a profound experiences that you've shared with us. I know we're all really thankful. I would like to thank a few people, especially before we close out. I'd like Louise O'Donnell to stand, if you could. If you know Louise, she's a force to be reckoned with, and we have a lot to thank her for in terms of connecting our panelists with us. I can honestly say if it wouldn't have been for your incredible energy in this, we would have never been able to pull this off. So thank you so much. This next group, I know if I tell them to stand, they'll kill me. So I won't. I would like to thank Naranjan Sathival and Aaron Boggs for their leadership work with Open and Out and bringing this to us. And then, of course, finally, I'd like to thank our panelists one more time. What an amazing experience. Thank you. Thanks, everybody. Thanks for your participation. Thanks for being very honest and open and I think vulnerable with us. And we'll give you back your day. Thanks. Thank you so much.